Welcome to rehabrunning.co.uk, getting you back on the road after injury. Here's a Kinesio taping technique for patellofemoral pain. Okay, so we're going to do a K-taping technique for patellofemoral pain now. Again, my biggest issue I've got with taping full stop is that it's not tailored enough to the individual. There's these generic sort of approaches that are being put on to everybody. The critical thing with taping full stop is that it should bring about a reduction of greater than 50% in the patient's pain doing a particular task that has been identified as their painful task. Right? So for our man here, he is getting pain when doing a single leg squat. And what we've done is we've modified that by pulling on a little bit of VMO, and that's reduced his pain. Manually acting as a little bit of a lever to try and to tilt the patella more medially has actually reduced his pain. And then in addition, offloading his fat pad has reduced his pain. So we're going to do a taping technique using the K-tape to address all of those three components. So the first component that I'm going to hit up is actually that gliding or that tilting component here. And with the K-tape, the method that I like to use with this is that you start out laterally through here, a good rub in order to make sure that sticks. Bend the knee slightly. From the bent knee position, what we're going to do then is take the two tails in our hands here, and we're going to work either side of that kneecap, so some tension on, placing it down, full tension onto the tape until we get to the last inch or so, and then the same thing wrapping around, last inch or so, and then that goes on, just no tension at all. So that's addressing an aspect of that tilt. We're offloading the tissue here to enable that to sit more centrally. Second bit that I'm going to do is to offload the fat pad. So the fat pad strip that's just enough to sort of cover the base of the patella there. I'm going to pull that apart through the middle, so we've got an inch sort of either end. And what we're going to do with that is take full tension onto the tape, place it in the middle, and then lift up and placing down. No tension onto either end. Job done. Final bit then, so we've got a nice puckering up of that tissue into here. Final bit, trying to address a little bit of VMO versus VL ratio, fairly well published that there's some discrepancies going on there between these muscle groups. So we start on the tibial tuberosity. We then get full flexion of the knee. And from there, what we're going to do is we're going to put tension on the lateral or the VL, running that right up. And then we're going to go for more of a proprioceptive effect, so no tension running along VMO. So, perfect. We're in through there. Get him up, form his aggravating factor again, and ensure that we've got a 50% reduction in symptoms. Done. You've been watching rehabrunning.co.uk, giving you a patellofemoral pain kinesio taping technique.